One of their benchmarks in the clinical trials is they decrease protein. It's our main kidney herb. It's the one that's been used the longest. You're not filtering properly, so we see. Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution, and co-author, I should say, and co-founder of Kygenesis, which is our supplements that support the program. And I am joined again today by the amazing Jessianna. So I'm going to hand it across to you to first. Maybe let's cover what it is, what it means, why does it happen, why does our urine get bubbly? Does it definitively mean we have kidney disease?
Okay, good question. Now, there's a common question that comes up, and it's really important to know symptoms of kidney disease because outside of labs, symptoms can be a good marker of what's working and not working. So one of the symptoms of kidney disease is bubbles in the urine or foamy urine. But, foamy urine or bubbles in the urine is a sign that you are spilling protein. But one of the main thing is usually you're spilling some sort of protein. So I always like to say you have leaky kidneys. We talk about leaky gut. You can also get kind of leaky kidneys where the mechanism of filtration is altered because of inflammation, because of the disease process. And because of that, you have protein that should not be getting into your urine. And when you pee, that ends up creating bubbles. And, different people at different stages, this is a sign that many, many people are familiar with.
And just for those wondering, there are 3 key herbs that have a lot of scientific research behind them. The bulk of the herbs in our Kidney Prime formula will, one of their benchmarks in the clinical trials is they decrease protein in the urine. But Shen or red sage, Salvia mycorrhiza, which is our main kidney herb. It's the one that's been used the longest. What Shen does is anti-fibrotic, which I love about it. So it reverses the fibrotic processes that are going deep inside the kidneys, which is what causes your EGFR to decline, right? Because the kidneys become fibrotic, so you're not filtering properly. So we see, think of a nice flexible substance and then it becomes fibrotic and hard, and that just, you can't filter properly. So Shen reverses that process and allows more flexibility by allowing really deep microcirculation. So it improves blood flow right throughout the body, which is great if you've got things like diabetes, cardiovascular disease, because that's part of that process, right? When you've got cardiovascular disease and kidney disease, there is damage to the little capillaries that feed nutrient and oxygen into the kidneys. So Shen really supports that, and it's been shown to decrease protein in the urine, probably because it's reducing the fibrotic process, meaning that you've got nephrons and your tubules have become more flexible. So as protein comes through, it's not hitting a hard thing and breaking it apart. I'm trying to make it as simple as possible, but you've got more flexibility and they're allowing protein particles to get through without causing damage. So you're not getting a spillover.
Yeah.
And then Astragalus, or Astragalus, as you would pronounce it in the US. We say it differently in Australia. I was like, Astragalus. People are like, we have no idea what that is. Oh, Astragalus.
No one knows how to pronounce it either way.
Right. Well, in England and Australia, it's Astragalus, but Astragalus. That does the same thing. It's because of it's because of this anti-fibrotic part that it has about it. So that one does the same thing. Interestingly, another herb which isn't actually very specific for the kidneys, but St. Mary's thistle or Silymarin, milk vetch is its other name. It's a very hepatoprotective herb. So it works on the liver. That has also been shown to decrease protein in the urine. And I would have to go and look into the studies about what mechanism that works behind. It might be anti-fibrotic as well. We know in liver disease, when we use things like Silymarin, it regenerates liver tissue. And so I'd assume it's got, if you've got liver fibrosis, it might be working that way as well. It doesn't have this deep microcirculation component to it like Shen does, but potentially it's anti-fibrotic. I don't actually know the mechanism behind that one, just the other 2, because they're big main kidney herbs. So they're the big 3 that I would think of employing if I had someone with everything else you said. And 101, like you said, don't go to herbs. You've got to really do the dietary intervention and look at your protein intake. That's the most obvious place to start. And then you use herbs to maybe look at healing some of the tissue and maybe reversing some of that fibrosis while you're taking the driver off behind it, if that makes sense. Jessianna, thank you. Make sure you hit subscribe and like the video. That means you'll get flagged anytime we put up new content. And if there's anything in particular that you want Jesse and I to discuss, make sure you dump it in the comments below and I can flag her so she can get her research brain on and have a look. So again, thanks for being part of our community. Jessianna, thank you again for your time, knowledge, and expertise. I'm always grateful for you. And we'll speak to you all later. Bye.
Okay, sounds good. Bye-bye.